1919 was an auspicious year in history. The First World War ended, ushering a drastic change in the world order. The Philippine Islands had been a U.S. territory for 2 decades and was promised independence under the Jones Law of 1916. Progressive reformers saw the country and its people as a major target for modernization, and education was its main weapon. 7 forward-looking Filipinas came together in 1919 to create a school where young women could gain the knowledge and skills that would make them modern women. Paz Marquez Benitez was the first president of the Philippine Women's College. Jose Abad Santos was its first chairman of the Board of Trustees. Francisca Tirona Benitez was the second president, and with her husband Dean Conrado, guided the school from a house on A. Flores Street to its iconic Taft Avenue campus. In 1932, the college became a university, making PWU the first university for women in Asia founded by Asians. It provided a space where innovations in education flourished, and young people were encouraged to be the best that they could be. For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. Today's PWU offers undergraduate and graduate courses in several fields of study. Its business and management programs are responsive to the needs of industry, using evolving technology for global competence. PWU graduates excel in arts and sciences, education, social work, and diplomacy. Its fine arts and music programs have produced outstanding graduates through a holistic education that treasures heritage as well as excellence. PWU has pioneered in fields such as food science, nutrition and dietetics, medical technology, pharmacy, and nursing. PWU continues to play an essential role in producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
Good morning, ladies and gentlemen. A blessed day to everyone for our webinar rules and regulation. Find a place conducive for listening. Put your mic on off or mute to avoid unnecessary noise and unusual sounds. Lend an ear if someone is speaking. Let him or her finish the statement before stating your point of view. For the question and answer portion, prepare your question for the speaker and wait for the cue of the host on when to submit it via live streaming chat box. Lastly, observe online etiquette all the time. Thank you for finding time to be with us today. I'm Yolanda, a student of Philippine Women's University, Doctor of Philosophy in Nursing program. It is my honor to be here as the host of this webinar.
Morning, everyone. I'm Ethan, student of Philippine Women University, Director of First Degree in Nursing Program. Today, I and Yolanda will be the co-hoster in this webinar. Before we proceed, I would like to inform you that we are live by Zoom, Facebook, and YouTube. Please check the like and share so that more of our nursing students may be within our webinar. Thank you.
Now, there will be played the PW National Anthem and Doxology, then the song of China's new coronavirus anthem, Believe Love Will Triumph.
Sa simoy at sa langit mong bukaw, may dilagang tulad, awit sa paglayang minamahal. Ang kisap ng watawat mo'y tagumpay na nagdidinig. Ang bituin at araw niya kailan pa may di magdidinig. Lupa ng araw ng at ipagsinta mo'y langit sa piling mo. Aming ligaya
了你，我拼了命，哪怕面对枪林弹雨，隔着生死的一道门，我保证不离不弃。最难舍是这份情，在你面前我要淡定，
撑起多少个黑夜，绝不让生命交替。我们坚信，有爱就会赢。你有多痛，我就多痛心。
有难一起扛，共分难才更坚强。风雨中凝聚民族的力量。我们坚信，有爱就会赢，无法拥抱却离你最近，真情守望，长江黄河水流长，我们凝聚起中华民族的力量。
Thank you. Good morning once again. We are so happy with your presence and participation in this activity. Please do not forget to click like and share so that more people may be within our reach. And now, to formally welcome you all to this morning activity, we would like to call on our mentor, Dr. Marietta Fabros, for opening remarks. Marietta Fabros, former Philippine Army Chief Nurse and former Dean of PW School of Nursing. She is our professor in current trends and issues in nursing practice, and she has been with us for 4 semesters. We would like to be here to formally and sincerely thank her for her help. Welcome, Dr. Marietta Fabros.
Thank you, Yolanda. Good morning to everyone. It is a great pleasure for me to welcome you to this virtual seminar on current trends and issues in nursing. On behalf of the Philippine Women's University School of Nursing, I would like to thank personally our speakers, Ms. Lee Kasia and Ms. Liu Weihao, for the time and effort to share their thoughts and expertise. Your depth of understanding of the subject will enhance the knowledge of our graduate students, to the organizers, and to all of you joining us this morning. Thank you. The changing complexity of the healthcare environment requires highest level of scientific knowledge and practice expertise to ensure high quality patient outcomes. Research allows our nurses to generate new knowledge which will benefit not only the present generation, but future generations as well. This is of equal importance because research develops values like discipline, integrity, as well as humility to those who engage in it. Moreover, it is our primordial duty to integrate evidence-based nursing practice in our works through consensus, explicit, and judicious use of newly derived research-based information in making decisions concerning care delivery to individuals or groups of patients and in consideration of individual needs and preferences. Last but not least, we are expected to be able to define and recognize different types of research and how each type contributes to the advancement of knowledge about health and the healthcare system, how to access information regarding advanced nursing practice, recognize the interface of health research and of research and quality improvement, discuss the future challenges for healthcare research and the impact they will have on advanced practice nursing. I invite all of you to contribute towards the realization of high quality patient outcome. I wish you all a very thankful, fruitful exchange and an enriching experience. Thank you.
Thank you, Dr. Marietta Fabros. And now, may we call on our dear classmate, Yang Hui, Sandy, to introduce us this morning's speaker, Sandy, Doctor of Philosophy in Nursing Program, now working as the head of nurse of thoracic surgery in Henan Provincial People's Hospital, China.
Good morning, everyone. It's a great honor for me to introduce our speaker. The first distinguished keynote speaker this morning is Ms. Li Caixia, who has received a master's degree in nursing from Fudan University in Shanghai in 2018, and is currently studying for a Doctor of Philosophy from Chinese University of Hong Kong. She has presided over many scientific research projects, such as resilience and quality of life in liver cancer patients, and going trans-arterial thrombolysis, and action research on evidence-based curriculum construction of surgical nursing, and published the book Surgical Nursing in 2018. She was honored to be invited in different seminars and conventions as a guest and a resource speaker. To all of our participants this morning, it's a great honor and privilege for me to introduce and welcome Ms. Li Caixia.
Hello everyone, I'm Li Caixia, a Year 3 PhD candidate at the National School of Nursing, the Chinese University of Hong Kong. It's my great pleasure to be invited by the Henan Provincial People's Hospital to share on the topic Nursing Roles in Screening and Early Detection of Cancer, Current Issues and Future Trends. So we're going through on this topic through a systematic review, which includes background, study aims, objectives, methods, results discussion, research gaps, limitations, and implications for future nursing practice research. The global cancer burden is increasing rapidly. According to the International Agency for Research on Cancer, there is an estimate of 19 million new cancer cases and 10 million cancer deaths occurred in 2020. In 2040, the new cancer cases and deaths will be increased to approximately 30 million and 16 million, respectively. According to the World Health Organization, the focus of cancer early diagnosis is people who have symptoms and signs consistent with cancer. The objective is to identify the disease at the earliest possible opportunity and link to diagnosis and treatment without delay. In contrast, screening aims to identify and recognize the cancer or its precursor lesions in an apparently healthy asymptomatic population by means of tests examinations, imaging, or other procedures that can be applied rapidly and accessed widely by the target population. Current guidelines have recommended mammography, Pap test, fecal occult blood testing, colonoscopy, or low-dose CT scan for screening of breast, cervical, colorectal, and lung cancer among populations who are at an increased risk of developing cancer. Screening and early detection of cancer is related to reduced cancer morbidity and mortality rate. In breast cancer, the mammography screening programs can reduce breast cancer deaths by about 20% to 60%. In cervical cancer, the screening could reduce the cumulative incidence by around 20% to 50%. The colorectal cancer screening could also reduce mortality by 53% to 68%, and also the risk of developing colorectal cancer. The lung cancer screening could also reduce a 20% mortality rate by using the low-dose CT scan. Despite the observed benefits, the utilization of screening and early detection services remains suboptimal in most of the countries. In Europe, the breast cancer screening uptake rates remains less than 50%. In Northern Italy, the colorectal cancer screening uptake rates is only 26% in 2013. In the United States, the breast cancer, cervical cancer, colorectal, and lung cancer screening uptake rates remain less than the proposed targets by the American Cancer Society. Similarly, in China, only 21% Pap test uptake rates was reported in 2010 in the nationwide data. The barriers to the early detection of cancer are categorized at multi-levels. At individual level, the factors included lack of cancer and screening knowledge, lower awareness, lower perceived cancer threat, lower need on screening, embarrassment, fear of screening procedure or outcome, distrust of the health providers, lack of time, etc. At social and cultural levels, the factors included family support, personal or family experiences with cancer, stigma, or lack of family physician recommendation. At the structural level, the factors included difficulty in accessing to screening service, limited resources on health infrastructure, the time constraints or long waiting time at the health facilities, high costs, and lack of insurance coverage on the screening tests. Nurses have important roles in screening and early detection of cancer. As emphasized by the World Health Organization, it highly emphasizes to optimize the scope of nurses and allied health professionals' practice to contribute to prevention and control of non-curable diseases, including cancer. Indeed, nurses have multiple roles in early detection of cancer, including coordinator to organize and manage the administrative needs of the program, educator to inform and enhance awareness of cancer and screening, navigator to ensure patients are guided through the initial evaluation to the subsequent screening rounds, practitioner to monitor screening results and relay pertinent test information to patients, and a researcher to refine the screening process through research. The multiple nursing roles has ensured comprehensive nurse-led interventions in early detection of cancer. In this review, we define nurse-led interventions are delivered through collaborative or innovative mediations by nurses who play various significant roles in promoting participants' adoption of the early detection behavior. The nurse-led interventions could firstly raise patients' or participants' knowledge, awareness regarding cancer and early detection. It can also promote behavior change. For example, the nurse-led reminding could remind the rescreening time and early detection behavior, such as the self-examination of the skin, or nurse-led counseling could also provide tailored information on motivation, stressing, to promote patient perceived self-efficacy in undertaking the early detection behavior. Last, it can also facilitate service access. For example, the nurse-led navigation programs can help to address patient service access barriers, such as addressing concerns regarding the screening procedure, to understand their insurance coverage, setting appointments, and planning for the transportation, etc. However, the current nurse-led interventions on early detection of cancer have discrepancies on intervention types, approaches, contents, sample sizes. Thus, the consistent results are difficult to obtain. Also, there is a lack of evidence on this area. There is no systematic review so far to our knowledge has been published in this area. Therefore, the aim of this review aims to synthesize the evidence of nurse-led intervention effects on early cancer detection. The objectives were to identify nursing roles and characteristics of nurse-led interventions in early detection of cancer, to evaluate their effects on improving the uptake rates of early cancer detection, and assess the intervention effects on cancerology and early detection beliefs, including perceived cancer threat, perceived benefits, barriers, and self-efficacy to undergo early cancer detection behavior. To similarly assess effects on diagnosed abnormalities and early cancers. This systematic review and meta-analysis was conducted according to the PRISMA statement. We developed such strategies with assistance of a medical specialist librarian. From inception date to September 2019, 8 English language and 3 Chinese language databases were searched. 3 literatures were searched using European Association for Great Literature Exploitation, clinical trial registers, and the WHO search portal. The reference list of included studies were also assessed for eligibility. We developed a search term for each category, including nurse lead, cancer, early detection, and randomized controlled trials. These search terms were used in titles, abstracts, or keywords. Match term search was also applied. No date or language restrictions were used. We set inclusion and exclusion criteria for participants, interventions, comparisons, outcomes, and study design. We included general and high cancer risk populations. Studies on cancer patients were excluded. Studies on healthcare providers as participants were excluded because these aim to improve early cancer detection service. We only included nurse-led interventions. Interventions thus delivered by other healthcare professionals instead of nurses were excluded. Studies that involved the nurses' meaningful medical practice or assisting in parts of the intervention were excluded, as nurses did not play the central roles. Studies with standard care, usual care, or no intervention comparators were included. Studies had to include one of the following outcomes. The primary outcomes were uptake rate of early cancer detection, including the screening tests, clinical and self-examinations. The secondary outcomes included cancerology and early detection beliefs, such as the perceived cancer threat, perceived barriers, benefits, and self-efficacy to undergo early cancer detection. Other outcomes included detected abnormalities and cancer cases. Only randomized controlled trials were included in this study. Two-stage screening process was applied. First, titles and abstracts were assessed after removing duplicates using Keynote. Secondly, full text papers were assessed. One current paper was translated into English for assessment. Each study was assessed independently by 2 reviewers. Discrepancies were resolved by discussion between the 2 reviewers or by consultation from a 3rd reviewer if necessary. We applied a standardized form to extract the following information: study design, setting, participant characteristics, types of involved nurses, competency, and received trainings of these nurses, intervention types, contents, format, duration, and outcome data. For studies reporting more than 1 intervention groups that which involved nurse-led intervention was selected. 2 reviewers independently assess risk of bias of included studies. For individual randomized controlled trials, The revised Cochrane risk bias tool for randomized controlled trials was used, including 5 domains: randomization process, deviations from intended interventions, missing outcome data, outcome assessment, and selection of reported results. For cluster randomized controlled trials, the RB 2-point additional considerations for cluster randomized controlled trials were used, with an additional domain for evaluating the risk of bias due to timing of identification and recruitment of participants. So each of the study was just as at low risk of bias, some concerns, or at high risk of bias based on the criteria. The data was synthesized using Review Manager 5.3 software. Relative risk and 95% confidence intervals were used to summarize effect size. P-value less than 0.05 was considered as statistically significant. Heterogeneity was calculated by Cochrane Q test and R-square, with p-value less than 0.1 indicates significant heterogeneity, and a randomized effects model was adopted. Otherwise, fixed effects model was used. We also applied sensitive analysis, subgroup analysis, and descriptive analysis for data cannot put into meta-analysis. A total of 10 studies were formally included in this review. Here is the PRISMA selection flow diagram. There are 4 studies evaluating nurse-led intervention effects for screening of breast and cervical cancer, 1 for lung cancer, and remaining for screening of colorectal cancer. 4 types of nurses were mentioned in the nurse-led interventions, including community health nurses, advanced practice nurse, research nurse, and specialist screening nurse. 3 studies set criteria for nurses, including having a master's degree, familiar with cognoscopic constraints, and expert in education. 3 studies provided specific trainings for nurses, including cancer risk communication, motivational interviewing, and consultation simulation trainings. 4 types of nurse-led interventions were identified, including education, patient reminder, patient navigation, and counseling. For education, it provided cancer and screening-related information, such as the symptoms of early cancers, incidence and susceptibility of developing cancer, the methods of screening tests, perceived barriers, benefits, and access information of screening services. Patient reminder were conducted by telephone or combined with reminder cards, booklets, or calendars to remind users of undertaking cancer screening tests. Patient navigation adopted multiple components, including education, motivational interviewing, patient reminders, and case management. Regarding counseling, it also includes multiple components, such as education on cancer screening, the rationale, recommendations, and procedures of these screening tests, pros and cons of undertaking cancer screening, tailored information, exploring and addressing barriers to service access. 3 studies reported no intervention for the comparators. 3 studies used the standard screening information, and the remaining provided usual care. Most of the studies were evaluated as having high risk of bias, and 1 studies were evaluated as low risk of bias. The combined effects demonstrated that nurse-led intervention can significantly improve the mammography uptake rates with risk ratio of 1.97. And the combined effects also showed a greater uptake rate in the study group compared with control group, and also the combined effects of patient navigation has higher combined effects than consoling on improving colonoscopy uptake rates. However, the combined effects were not statistically significant regarding the fecal occult blood testing uptake rates after nurse-led interventions. Only 1 study evaluated the pap smear test uptake rates after nurse-led interventions, and the rate in the intervention group is higher than in the control group, with 38% and 0% respectively. Nurse-led interventions can also improve cancerology, such as the breast cancerology, lung cancerology, and colorectal cancerology. The category including the risk factors, symptoms, screening indications, methods, frequency of undertaking cancer screening. Nurse-led interventions can also improve cancer screening beliefs, such as their perceived cancer threat and benefits of undertaking cancer screening after education and navigation, and reduce their perceived barriers in undertaking cancer screening and early detection services. Mixed findings were found on early detection beliefs. For example, increased self-efficacy in South breast examination practice were observed after education, but not in lung cancer symptom consultation self-efficacy after consulting. The difference may be due to the various types of nurse-led interventions and their effects on early detection self-efficacy can be further explored in future studies. Only 1 RCT evaluated intervention effects on abnormalities and early cancer cases, and showed that 1 invasive cancer and 11 cases of advanced colorectal adenomatous polyps were detected in the study group, significantly higher than that in control group. However, no early cancer cases were reported in this study. The included randomized control trials in this review have several limitations. First, the included studies have methodological weakness, such as lacking tailored allocation concealment inappropriate analysis of missing outcome data, using self-report methods to evaluate early detection behavior, and leaking information on blinding outcome assessors. Second, the included RCTs only explored intervention effects on a number of cancer types, thereby limiting the application to other cancer types. Third, the meta-analyses were not conducted on other outcomes due to the high heterogeneity in using different methods and self-made questionnaires. Lastly, given that no meta-analysis included more than 10 studies, the publication bias was not assessed in this review. Based on the study results, we suggest the future nursing practice should highlight the importance of identifying those at increased risk of developing cancer and ensure that appropriate screening tests are adopted in patient care, and to apply essential components when delivering the nursing interventions, such as the education, reminding, counseling, and navigation. For future nursing research, the RCTs need rigorous designs with respect to allocation concealment using objective methods such as the medical records to measure the screening uptake rates, blind outcome assessors, and apply appropriate analysis on missing outcome data. To further explore the optimal intervention type and components and apply to early detection of other cancer types and the intervention effects on early cancer cases and long-term intervention effects. The use of social media in delivering these nursing interventions can be further explored in future studies. Last, valid scales can be developed to assess cancerology and early detection health beliefs in different cancer types. In conclusion, the review analyzed the nursing roles and nursing intervention characteristics in screening and early detection of cancer, and we found nursing interventions have positive effects on improving early detection uptake rates in breast cancer, colorectal, and cervical cancer, and increasing cancerology in breast cancer, colorectal cancer, and lung cancer, and increasing perceived cancer threat and early detection benefits, but decreasing perceived barriers in early detection of breast, cervical, and colorectal cancer. It also promoted the self-efficacy of performing breast self-examination and early detection of abnormalities. Last, navigation may be superior to counseling, improving colonoscopy uptake for early detection of colorectal cancer. These are references. Our study has published on the International Journal of Nursing Studies, in which more details can be found. Many thanks for listening, and welcome for questions.
Thank you once again for that inspiring talk. We learned from the speech that nursing roles and nursing-led intervention in screening and early detection of cancer, as well as the effects of nursing-led interventions on cancer screening uptake rates, cancer knowledge, and early detection beliefs. I'm sure our nursing community appreciates you so much for committing to the care of cancer patients. Now, the next part will be held by my co-host, Ethan.
Thank you, Yolanda. Now, may I call on our dear classmates Xiaming, Miranda, to introduce us the second speaker. Miranda, Doctor of Philosophy in Nursing program, now working as the head nurse of intensive care in Henan Provincial People's Hospital, China. Now, welcome, Miranda.
Hello, everyone. Now, we move to our next keynote speaker. She is a nurse by profession. She is a registered nurse. Currently, she is Nursing Deputy Director of Nursing Department of Henan Provincial People's Hospital. She graduated from Jilin University in 2012 and got the master's degree in nursing. Now, she is studying for a doctorate in philosophy at the PWU. This year, she presided over scientific research projects, the joint co-construction project of Henan Province's Medical Science and Technology Research Program, and she published many articles as the first author. She also is employed as the undergraduate tutor of nursing school in Zhengzhou University. However, she religiously attends conventions, conferences, seminars, and symposia annually to keep abreast with the new trends of her profession, particularly in the healthcare field. Similarly, she never fails to attend training to keep self-updated, thus delivering competent practice based on the best available evidence-based standards. She is a caring nurse, a passionate nurse educator, and a dedicated nurse leader. Ladies and gentlemen, it's my privilege to introduce our keynote speaker, Ms. Liu Weihua.
Good morning, everyone. Thank you for Miranda's introduction. I'm Sarah, and my Chinese name is Liu Weihua. I'm a student of philosophy in nursing from the School of Nursing in Philippine Women's University. I'm a nurse from Henan Provincial People's Hospital in China. And today I'm so glad to share my topic, nursing discipline construction of the research hospital in China. And also I will introduce the nursing discipline construction experience of my hospital. Today my topic includes 4 contents. The first content is I will introduce what is research hospital. The second, I will introduce what is the research discipline in research hospital. And the third part, I will introduce why we should do the nursing discipline construction. And the last part, I will introduce the nursing discipline construction experience of my hospital. It is called the 6 constructions and 1 evaluation discipline construction system. So firstly, I will introduce what is research hospital. Today, scientific and technological innovation has become a key support for improving overall national strength. With the development of society in China, clinical hospitals are gradually changing to research hospitals. In China, the first paper which mentioned research hospital was published in 2003, but it didn't explain the definition of research hospital. And then, in 2007, Jin further developed the definition of research hospital as a first-class hospital with a mission that produces and diffuses new medical knowledge and new medical technology. So about the research hospital, there are several features of it. The research hospital mission is the generation and dissemination of new medical knowledge and new medical technology, and it emphasizes the parallel development of clinical work and scientific research. It means that the research hospital not only do the clinical work well, but also it pay more attention on the scientific research. Both clinical research and basic research should be promoted in the research hospital. And in the process of independent innovation, the high-level talents and high-level achievements are constantly produced. And the levels of clinical diagnosis and the treatment improves continuously. And also the research hospital have advanced management concepts. So the research hospital plays an important role and is the backbone of effective treatment of severe diseases. From the diagram in the slide, you can see there are 3 levels of the hospital. According to the functional tasks of hospitals, the hospitals can be divided into 3 levels. At the top is the research hospital, the second level is clinical hospital, and the third level is general hospital and primary hospital. But what is the differences in these 3-level hospitals? I will introduce one by one. The main functional tasks of research hospital is that, firstly, the diagnosis of treatment of difficult and severe disease. It means that the research hospital treat diseases that ordinary hospitals cannot treat, and also perform operations that ordinary hospital cannot do. Secondly, the research hospital formulate norms and popularize them to clinic hospitals and general hospitals, and also improve the homogeneity of diagnosis and treatment in China. So about in terms of clinical hospital, the main function is to diagnose and treat the not severe disease, and the function of the general hospital and the primary hospital is mean prevention and rehabilitation of the disease and to treat the common disease. So these 3-level hospital have the different functions. In part 2, I will introduce what is the research discipline. Research discipline is clinical work based with the mission of generating and disseminating new medical knowledge and medical technology. It adheres to the method of clinical work, teaching and research developing simultaneously to solve the clinically difficult and complicated diseases. During the process of independent innovation, it continues cultivating high-level talents and the birth of high-level outcomes, leading technology innovation and development, forming technology guidelines, occupying the commanding heights of academic, while paying attention to and promoting the continuously improvement the level of clinical diagnosis and treatment. This is the definition of research discipline. And also the construction of research discipline is very significant, because the level of discipline is one of the main indicators reflecting the level of a hospital, and also the discipline construction is a key to the core competitiveness of the research hospital. So there are several main features of the research disciplines. The first one, the research discipline has the ability to diagnose and treat difficult and complicated diseases. And the second one, it has the ability to lead the development of the industry's technology innovation. The third one, it has the ability to train compound talents with high quality. The third one, it has the ability to produce high-level scientific research results. The fifth one, it has the research direction with international competitiveness. And another one is it has a well-known domestic academic leaders. The last one is it has a highly efficient translational medicines. So this table shows us the difference between research discipline and the general discipline. In terms of the focus of medical care, the research discipline focuses on the difficult and complicated diseases, but the general discipline focuses on the frequently occurring diseases. In terms of achievements in scientific research, the research discipline have the high-grade achievement transformation, but the general discipline have the clinical work summary and promotion. In terms of the talent training, the research discipline train the compound talents with medical, teaching, and scientific research skills, but the general discipline trains the clinical talents. In terms of the development orientation, there also has differences. The research discipline focus on the quality connotation, but the general disciplines have the goal of quality and skill, quantity and skill. In terms of main functions, the research discipline pay equal attention to clinical and scientific research, but general discipline pay attention to the clinical diagnosis and treatment. In terms of the technological innovation, the research discipline lead industry development and innovation, but the general discipline makes the imitative innovation. At the last one, in terms of medical model, the research discipline has the translational medicine, but the general discipline has the traditional medicine. About the discipline assessment of the research hospitals, there are 5 aspects: discipline management, discipline talents, teaching level, level of medical care, and scientific research level. So the development trend of research discipline construction is that from the traditional division to specialized comprehensive transformation, from the professional and technical characteristics to function, optimization and expansion, and also change from relying on academic leaders to relying on not only academic leaders but also the reasonable talent echelon, from emphasizing the driving effect of key disciplines to emphasizing the dynamic management of discipline level. Transformation from the asymmetric communication of information to the development of international network automation, and also from the investment focus to the pursuit of sustainable development. This we should know the development trend of the research discipline construction in China. And next part, I will introduce the connotation of nursing discipline construction. For nurses, the nursing discipline construction can cultivate compound talents who are both clinical, teaching, and scientific research, and also enhance the role of nursing staff in academic and decision-making to achieve the growth and sustainable development of the nursing team. For hospital, the nursing discipline construction can improve the hospital's service quality, enhance the hospital's core competitiveness and brand effect, and also promote the realization of hospitals' long-term strategic goals. And for the society, the nursing discipline construction improves the contribution and the influence of nursing staff in the field of primary health care and universal health care, and also increase the contribution of the nursing team to the sustainable development goals. Next, I will introduce the status quo of the construction of nursing discipline in China. From the left of the slide, you can see there is the numbers of nurses in China. From the 1998 to 2019, the number of nurses increases from 1.22 million to 4.1 million, and 48% of nursing staff with a college degree or above. But at the end of the 2019, there are 4.45 million registered nurses nationwide, and more than 70% of nursing staff with college degree or above. But at the end of 2020, the number of registered nurses in China reached 4.79 million. So from this trend of the numbers of nurses in China, we can see the team of nursing staff is growing, and also the education level of the nursing team is gradually improving in China. So, meanwhile, I will introduce the status quo of the construction of nursing discipline. It is called the double first class nursing discipline construction. In 2015, the country put forward the development strategy of double first class, that is, world-class universities and first-class disciplines, which has now become a key indicator for judging the core competitiveness of schools and hospitals. So this figure shows us the key elements of the construction of double first-class nursing disciplines. You can see there are four requirements. Includes the nursing innovation, the talent development, and the disciplinary collaboration, and the international collaboration and exchange. In the last part, I will share the experience of our hospital in nursing discipline construction. It called the 6 constructions and 1 evaluation nursing discipline construction system. Firstly, I will introduce my hospital briefly. My hospital is Henan Provincial People's Hospital. It was established in 1904, and now it is 117 years old. Now, this slide shows the development of my hospital. It has a long history. Now, my hospital has about 5,700 beds and 249 ICU beds, receives 3 million emergency cases, and makes over 90,000 operations each year. Every year, there are 170,000 person-time patients leave hospital. About the nursing team of my hospital, the nursing team have 3,353 nursing staff, is honored as a gold nursing team with pursuit for solidarity, endeavor, dedication, preciseness, factorialism, and innovation. The 6 constructions and 1 evaluation nursing discipline construction system was conducted by my hospital, firstly in China. I think it is a successful system for nursing discipline construction, and it will provide the reference for other hospitals to construct their nursing discipline. The 6 constructions include the organization management system, talents cultivative system, clinical nursing system, nursing research system, teaching and training system, and nursing disciplinary communication system. And 1 evaluation means the discipline evaluation system. Next, I will introduce them one by one. Firstly, the construction of organizational management system. It includes 2 aspects. The first aspect is optimize the discipline management framework. This framework is the nursing discipline management framework in my hospital. You can see the top level is the association dean in charge of nursing work. The second level is nursing department, the director of nursing department, and the third level, it shows the 4 deputy directors, and each deputy director is responsible for the different fields or different works, such as teaching and training, quality management, human resource management, and publicity, and also the nursing discipline construction department. In this part, I want to emphasize is that in my hospital, we establish the nursing research center. In my hospital, this center focuses on the research ability and the research level of our nursing team. So the next level is the different department in the specialist subjects union. And another aspect of this construction is that making a discipline development plan. We use the scientific management tool called the balanced scorecard to make our nursing discipline development plan. You can see this diagram. On the right is a vision. The vision of our nursing discipline is that to be the model of humanities nursing. And then, according to this vision, we make the long-term goals, we make the medium-term goals, and also we make the short-term goals. This table shows us the strategic map and the scorecard about the nursing discipline development. It includes the strategic objectives, key performance indicators, and target value from the finance, customer, and internal process, and learn and growth levels. The second construction is the construction of talent training system. It includes 3 aspects. First one is construction of nursing talent training excellence. This pyramid shows us the nursing talent excellence. At the top is discipline leader, its middle is the reserve talents, and the 2, 3, 4, 5, 6 nursing talents. And in the bottom is the nursing professionals at all levels. My hospital has issued a series of nursing talent training and management programs. The second aspect is nursing talent training mechanism. We established different training mechanism for different type talent training. So, for example, for the nursing discipline leader, we establish the training mechanism such as they can get special funds 10,000 yuan every year. They can enjoy the academic leader allowance 1,000 yuan every month, and also they can get professional training abroad during the term of office. For the training of nurses at all levels, we also make the training mechanisms such as the standardized training for new nurses, on-the-job hierarchical training for different level nurses such as N0, N1, N2, N3, and N4, and also training of specialist nurses in hospital. And in terms of 2, 3, 4, 5, 6 nursing talent project, we also make some measures to training this type nursing talent. The 2, 3, 4, 5, 6 nursing talent, it means the different age group of nurses. For example, the 2 means the 26 to 29 years old of nurses, and 3 means 30 to 39 age group of nurses. For this type nursing talent, we also establish the training mechanism such as selection, outstanding talents of all ages, and training. The circle is 3 years, and special funds for scientific research are given for this nursing talent, and also annual assessment, midterm assessment, and final assessment will be conducted. The last aspect is setting career development paths. This diagram shows us the 4 different career development paths, includes the clinical, management, teaching, and scientific research. Our goal is to make career plans for the nurses, establish career goals for the nurses, and also we encourage the development of compound nurses. It means that we hope our nurses become the compound talent They all have the clinical and management, teaching, and scientific research skills. The third construction is construction of clinical nursing system. It also includes two aspects. The first one is clinical nursing quality management. The nursing quality management based three-level quality control framework in my hospital. The first class quality control led by nurses in ward. The second level quality control led by departments, and the third level quality control led by nursing department. And also, we widely use the scientific management tools such as PDCA, quality control circle, and root cause analysis in clinical nursing quality control. And the hospital established the basic nursing quality index and the specialized nursing quality index as tools to evaluate the clinical nursing quality. Another aspect is practice of evidence-based nursing project. Our hospital has become best practice spotlight organization, also called the BPSO, designate and developed in changing ideas based on the best evidence, as well as continuously applying the best evidence in nursing practice. The BPSO is a section of the Registered Nurses Association of Ontario in Canada. And we are improving the scientific and rigorous clinical nursing practice and providing higher quality nursing services for patients with persistence. At present, the following three evidence-based guidelines are implemented in my hospital in different units, such as the pain assessment and management guideline, the pain-centered learning guideline, and the prevent falls and reduce injuries caused by falls guideline. The fourth construction is the construction of nursing scientific research system. It also includes three aspects. The first one is platform of scientific research. As I mentioned before, in my hospital, we establish the Nursing Research Center. The purpose of Nursing Research Center is to improve ability of scientific research of clinical nurses and improve the project establishment and paper output of nursing scientific research. And the Nursing Research Center also set up the 7 full-time scientific research nurses and 183 part-time scientific research nurses. About the work content of the Nursing Research Center, it includes the scientific research fund and project management, scientific research training, academic communication, scientific research consultation and guidance, and so on. The second aspect is establishment of scientific research team. This picture shows. This picture is all the members of the Nursing Research Center. This is me, and this is all my colleagues in the nursing research centers. They all have the master degrees of nursing, and also there are 2 members have the doctoral degree of nursing. And each secondary nursing discipline in my hospital sets up a research team to guide, organize the nursing scientific research in specialized discipline and improve the scientific research present. At the present, there are 183 part-time scientific research nurses in the whole hospital. And another aspect is refined discipline direction of the nursing discipline in my hospital. The main discipline direction of clinical nursing in our hospital includes the chronic diseases and health management, nursing care of critical illness and disaster, continuing care in internet plus, humanistic care and psychological nursing, and elderly care, tumor nursing and hospice care, and accelerated rehabilitation, surgery, and preoperative nursing. The fifth construction is the construction of teaching and training system. It includes two aspects. The first one is hierarchical teaching management. This diagram shows the hierarchical teaching management in my hospital. The dean in charge, and the next level is the nursing department, and the next level is the teaching and training section. The teaching and the training includes the college education, post-graduation education, and the continuing education. Another aspect is multi-dimensional teaching quality evaluation. It has established a multi-dimensional teaching quality evaluation system, which mainly includes the teaching quality evaluation, teaching process evaluation, teaching information feedback evaluation, and so on. This diagram shows the teaching and training system in my hospital. The quality control system includes the teaching quality standard system, teaching monitoring operation system, and teaching information feedback system. Another construction is the construction of nursing disciplinary communication system. This system also includes two aspects. The first aspect is communication and leading in the local area. In this aspect, there are four contents, such as the push of excellent courses and popularization of nursing technology. Establish a hospital community cooperation system, and organizing training courses and academic conferences, and also establish a communication network and expand publicity. Another aspect is the academic communications all of the world. In this aspect, there are four important contents, our programs, such as the master degree program, cooperation and exchange program, and cooperative research program, and the international academic conference program. So in this slide, I would like to show you the international exchange about the Congress of the International Council of Nurses in this year. On November 2 to 4, 2021, the Congress of the International Council of Nurses was gradually opened online. More than 900 nursing scholars in mainland China registered to participate, and more than 300 people give oral presentations. And in my hospital, there are 46 nurses participated in this conference, and the 4 of whom reported in the moderated concurrent sessions, and 42 reported in the individual concurrent sections. The last construction is the construction of discipline evaluation system. Our hospital conducted the nursing discipline evaluation standards to measure the level of nursing discipline construction, and these nursing discipline evaluation standards based on several standards from the national and provincial nursing discipline evaluation system, and also we use the Delphi method and expert argument method to make it. So it was made scientifically. So the discipline evaluation system mainly includes 5 first-class indexes, 21 second-class indexes, and 52 third-class indexes. The 5 first-class indexes include the basic conditions, discipline team, service capability, and scientific research level, and clinical teaching. Through the construction of nursing discipline in recent years, we also gain some achievements of the article published. In the past 3 years, 7 articles have been written about the construction of nursing disciplines in my hospital, with 6 articles has been published and 1 article is under review. The following is the articles has been published in the nursing magazines, journals. You can see these articles. In conclusion, the nursing discipline of research hospital should have the following 4 characteristics: taking the quality improvement of nursing services at the goal, taking continuous nursing innovation as a driving force, taking the cultivation of high-level nursing talents as a key, and taking the achievement of professional value of nursing as their own responsibility. I hope my sharing can help you to understand the trend of nursing discipline construction in the research hospital in China. And also, I hope the experience of our hospital in the nursing discipline construction can give you some suggestions to help you to construct the discipline in your organization. So this is all my sharing in this topic. Thank you very much.
Thank you, Ms. Liu. Thank you for your wonderful showing. From a speech, we learned that the practice and effectiveness of nursing discipline construction in research hospitals. Taking Henan Provincial People's Hospital as an example, we have a clear understanding of the background, the implementation plan, the implementation progress of the nursing discipline construction in research hospitals, and saw the effectiveness of the implementation plan and nursing discipline development in research hospitals. Now I have a new understanding of the development of nursing discipline. And thank you, Ms. Liu, again. Thank you very much for accepting our invitation, Dr. Liu. Once again, thank you for the two greatest. See in the chat box, there are some questions from our students. Next, we will have our host for the question and answer section, Howard. He's from Henan Provincial People's Hospital. Now we will have Howard in charge of the question and answer section. Welcome, Howard.
Thank you for your wonderful lecture, Dr. Li and Dr. Liu. I saw a lot of questions from the audience in the chat box. The atmosphere was very active. But due to the limited time, I can only choose a few. The first question is for Dr. Li. Hello, Dr. Li. Can you tell us regarding in screening and early detection of cancer, what do you suggest to promote its development under Chinese context?
Okay, thank you for your question. Actually, this is an important issue, how to inform nursing roles under Chinese context. Basically, based on the results of my systematic review, I may suggest two ways to promote nursing roles in China in this area. And firstly, providing trainings to clinical nurses would be most applicable to the clinical settings. In this review, the studies provided trainings to nurses, including cancer risk communication, motivational interviewing, and consultation simulation. Cancer risk communication training is especially important in China, considering the cancer cultural taboo. How to mention they have the risk of developing cancer to patients in a more psychologically acceptable way would be difficult. And motivational interviewing is also important to encourage patients adopt a screening behavior. So we highly suggest providing these trainings to clinical nurses to improve their ability in delivering education information, helping patients address barriers to service access. And through this way, we can construct nursing roles in a clinical setting. Second, we can affirm the aspect of advanced practice nursing, which can culture clinical nurse specialists in screening and early detection of cancer, such as the specialist screening nurse, as mentioned in the included studies. These specialist nurses can provide more professional services, such as the nurse-led clinic. We have noticed nurse-led clinic in liver cancer surveillance in other countries, but seldomly in China. Perhaps this has a higher requirement on nurses' qualification, such as whether they should have a master's degree or above, their work experiences, received their courses, etc. So, and also we, by culturing these nurses, we have to consider the hospital's support resources and local policies. For example, on certification and management of these advanced practice nurses in screening and early detection of cancer. So, the realizing of nursing roles in screening and early detection of cancer through specialist screening nurses in China has a long way to go and can be further explored in the future. Thanks for your question. Hope my answer could help you understand this issue. Thank you.
Thank you, Dr. Lee. The second question is also for you. As you mentioned, for types of nurse-led interventions such as education and counseling, which do you suggest to use in future nurse practice to promote early detection of cancer?
Okay, many thanks for this considerable question. I think it depends on patient needs, available health resources, and nurses' ability. We have mentioned 4 types of nurse-led interventions, including education, patient reminder, counseling, and patient navigation. Education is an efficient way to improve patient knowledge on cancer, cancer risk, and recommended screening tests and intervals. So we can increase patient awareness, perceive the cancer threat, and importance to have cancer screening. So in clinical settings, nurses can help to convey the education information to the patients. However, we have also noticed about nurses and other health professionals may also lack of knowledge in this area. So it is very important to provide trainings to clinical nurses, such as how to identify those at increased risk of developing cancer and to improve their knowledge on screening guidelines. So by doing so, we can enhance the ability of clinical nurses in conveying the information to patients. Second, patient reminder mainly focuses on reminding the users of right time and to perform cancer screening and how to perform the behavior such as breast self-examination. It is usually suggested to combine with other intervention components, such as in the outreach programs. And third, counseling is a combination of education, tailored information, and exploring and addressing access barriers. It is a combination of various intervention components. It is easy to conduct because it can be delivered either through face-to-face or telephone-based to consider patient convenience. And last is patient navigation. We can see it has a higher predicting effects on improving colonoscopy uptake rates compared with other intervention type. However, it has a higher requirement on nurses' ability in conducting the multiple component intervention. And also it would be difficult to have nurse navigators in China, considering the nursing shortage. But we have seen several published studies to explore the roles of nurse navigators in other areas, such as the rehabilitation after the surgery. So this type of intervention, the nurse navigation, although it's effective, it should be firstly explored the applicability and under Chinese context or in other cultures before being widely used. This is my understanding on this issue. Thank you again.
Thanks for the patient and meticulous answer, Dr. Lee. Thank you again. Thank you.
Okay, bye-bye.
But due to limited time, we can only ask the speakers to answer one more question. Okay. I can see an audience asking a question for Dr. Liu. Hello, Dr. Liu. What is the key to the high quality development of research hospitals in China? And how do you do?
Okay, thank you for this good question. And I would like to say one of the key points of building research hospital is the scientific and technological innovation. Another is the the personnel training. And meanwhile, the research hospital construction must always revolve around the discipline construction. So the success of research hospital construction is not only influenced by the external factors such as the social system, economic level, and the medical system, but also it depends on the internal factors such as the advanced management mechanism and high-level talent team and innovation scientific research. So most successful research hospitals at the home and abroad have the high quality diagnosis and the treatment levels, and the excellent innovation technology platform and achievement transformation ability that can effectively promote the effective connection between the scientific research and the clinical needs. So it also attaches importance to the introduction and the development of talents, a sound talent incentive and evaluation system, and also it emphasizes the cultivation of compound talents. At the same time, the research hospital has a professional management team and the financial accounting system, and also the introduction of information management system ensures the management efficiency. So this series of measures jointly promote the great leap forward development of research hospitals and also meet the requirements of the current national conditions or for the hospital constructions. So therefore, as the decision maker and executor of medical and health reform, we should pay more attention to the exploration of the practice of research hospital and strengthen the efforts to establish research hospital. Thank you.
Thank you, Dr. Liu. It's a great honor to hear your lecture. Okay, let's thank the active listeners again for their active participation and the speakers' patient answers. Due to the limited time, let's give the time to the host. Thank you, everyone. Thank you.
Thank you, Howard. Thank you, Ms. Liu and Ms. Li, to give us a presentation through our virtual space and give us a fresh perspective on the various concepts related to current trends and issues in nursing. Now, let us proceed to the awarding and the certificates of appreciation. It's my great honor to present the certificates to the two great speakers. The first great speaker from the Philippine Women University hereby award this certificate of appreciation to Li Caixia in grateful and scientific gratitude for her helpfulness and commendable service rendered as the research speaker during the conduction of the webinar entitled Current Trends and Issues in Nursing. Congratulations to Li Caixia. And then for the second speaker, Philippine Women University hereby award this certificate of appreciation to Weihua Liu. In grateful and scientific gratitude for her selfless and commendable service regarded as research speaker, during the conduction of webinar entitled Current Trends and Issues in Nursing. Congratulations to Liu Weihua, and thank you, Dean. Now let's proceed to the next section, the conference and the feedback section. Now let's welcome our classmates Sunshine and April to give their feedback of our webinar. First of all, let's welcome Miss Sunshine.
Thanks very much for Dr. Lee's speech. Through her speech, we know it is very important the role of nurse in early cancer screening. As you know, with the aging and repeat growth of the population, the number of cancer cases is also increasing rapidly all over the world. Cancer incidence and deaths in China are ranked first in the world. Cancer patients, due to their own disease development and the characteristic of treatment, often have many different symptoms, which are critical to the survival of the patient. Now, nurses are playing increasing important role in September management of cancer patients. And the role of nurses in September management of cancer patients, screening and evaluation, implementation of intervention measures, as well as health education and far of responsible for patients and their family members. Nursing intervention is effective in improving the quality of life of cancer patients from the physical and psychological aspects. Both have achieved significant results. Thanks again very much for Dr. Lee's speech. Thank you.
Thank you, Ms. Sunshine. Next, let's welcome April to give her feedback.
Sorry. Hello, everyone. I'm April. My Chinese name is Li Jingjing. I'm working in the Xi'an Jiaotong University, the second hospital in China. Very lucky and pleasure to share my feedback of Dr. Liu Weihua's wonderful report. Today, scientific and technological innovation has become a key support for improving overall national strengths. Nursing as a discipline plays a more and more important role. Through her speech, we learned about the construction of 6 systems and 1 evaluation project in the discipline construction of scientific research hospitals. These 6 systems are organizational management system, talents cultivation system, clinical nursing system, nursing research system, teaching and training system, nursing discipline communication system, and discipline evaluation system. The discipline assessment index system of research hospitals. The computation of nursing discipline constructions is elaborated thoroughly through the specific content by Mrs. Liu. It enhances our sight to understand the research hospital, how to develop, and the nursing department direction. Dr. Liu's hospital construction model is an example and an excellent path guide how to develop our nursing career as one discipline for us. Sincerely appreciate very much again for Dr. Liu's wonderful case speech. Thank you.
Thank you, April. Thank you again, Sunshine and April, for your feedback to our webinar. Now, I'd like to invite you to evaluate our webinar, and the link listed is available to log in. And you can see the link in the YouTube Zoom. Please open the link and evaluate our webinar. Thank you. As the number of attendance of more than 60 plus as a matter of the fact has filled up our 3 virtual space. To give us our closing remarks for the event, may I call on the chief nurse of Zhengzhou Yihe Hospital, Amy. Let's all welcome Amy.
I'm sorry, I can't turn on the camera now. Honorary favors, ladies and gentlemen, thank Ethan's introduction. I'm Zhang Mingli from School to Nursing TW. I'm so honored to give the closing remarks of this webinar. We are soon closing this international conference, which has been a great success. It went smoothly as scheduled. We have enjoyed the advanced professional program as well as a productive communication. I would like to appreciate the 2 key speakers, Dr. Li Taixia and Dr. Liu Weihua. They gave us wonderful speeches, which help us to understand the nursing rules and the nurse-led intervention construction of nursing hospital in China. This event has demonstrated with the international culture. It's very important and interesting. We can all come together to share our resources, ideas, and thoughts. Thank you so much. Meanwhile, I would like to thank you to the organizing committee. All of you are dedicated and made it success. And last but not least, thank you to Ms. Fabulous for making this webinar possible. Thank you for joining the webinar, for your support and cooperation with us. That's all. Thank you. Best wishes.
Thank you, Ms. Amy. Thank you for your first remarks.
Next,
welcome.
Let us express our sincere gratitude for supporting from the listening people and the related departments. Mr. Marco Alfredo Benitez, Dr. Minerva Diala, Dr. Marietta Fabros, and different departments in PW, Information and Communication Technology Department, Multimedia Center, Marketing Department. Thank you again. Thank you so much for taking part in this memorable occasion. To close this webinar, let us see the PW hymn and conference committee video.
Hello, darkness, my old friend. I've come to talk with you again, because a vision softly creeping left his seeds while I was sleeping, and the vision that was planted in my brain still remains within the sound of silence. In restless dreams I walk alone, narrow streets of cobblestones, neath the halo of a street lamp. I turn my collar to the cold, and then, when my eyes were stabbed by the flash of a neon light that splits the night and touched the sound of silence, and in the naked night I saw 10,000 people, maybe more, people talking without speaking, people hearing without listening, people writing songs that voices never share. No one dare disturb the sound of silence. Fool, said I, you do not know, silence like a cancer grows. Hear my words that I might teach you, take my arms that I might reach you, but my words like silence raindrops fell and echoed in the wells of silence, and the people bowed and prayed to the neon god they made, and the sign flashed out its warning in the words that it was forming, and the sign said the words of the prophets are written on the subway walls and tenement halls, whispered in the sounds of silence.